So benefits of weight loss surgery. We all talk about bariatric surgery, we think about weight loss, right? So all we think about weight loss. We don't realize how many other factors that it improves of our health. I was talking to my really good friend a couple days ago, primary care physician. I told them, our price for getting off diabetic medication could be under $10,000. He was amazed. You say for under $10,000, patients can get off their diabetic medication? Absolutely. If you look at the data over the last 30 years, all of these studies have been very, very concrete, showing that patients with diabetes have about 80% chance of being off their diabetic medication once they leave the hospital. Does that mean every patient's off their diabetic medication forever? No, right? Depending if you're on insulin, how long you're on insulin for, these all are factors that come in. But let's say you're a patient, you're on metformin for the last 4 years, your A1C is 7.2. I could confidently say the vast majority of those patients, their last dose of metformin will be the day the dose they take prior to surgery. And the vast majority of those patients after surgery will no longer be diabetic. And that's just diabetes. Let's look at hypertension. 6 months down the road, similar type of rates of resolution and improvement of hypertension. Sleep apnea. Most patients that aren't sleep apnea, don't have sleep apnea, they are diagnosed prior to surgery. I tell them to rent their CPAP out, so they likely won't need it in 6 months. The one thing we don't think about is fatty liver disease. We all hear about fatty liver disease, we're getting ultrasound or anything to that degree. Well, study has now shown that the only way to get rid of fatty liver disease is bariatric surgery. 80% of patients that have reversible fatty liver disease, their liver goes back to normal 1 year out from surgery. So it's amazing rates. I think we don't think about is PCOS. Patients that have PCOS have a lot of OBGYNs who send us patients because they have patients that are infertile because of PCOS. Well, look at the data. If you look at the data, you can see that the only true treatment of PCOS is bariatric surgery. We tell our patients who have trouble getting pregnant, make sure for the first year, try to use protection, because I can't tell you how many patients 7 or 8 months said, hey doc, I'm pregnant, but I couldn't get pregnant prior to surgery. Obviously those patients do great. The babies also do great. If you have, we want you to wait a year after surgery just to get to your low point of surgery before having a child. But even if you have a kid before that, the child does fine, the mother does fine, no problems. We just want our patients to get to the lowest set weight, which is around 1 year post-op for patients. But it's pretty amazing. People who have infertile issues with PCOS, they can now have babies because they can have surgery. We look at cancer, especially for female cancer, postmenopausal cancer like breast cancer, ovarian cancer that have to do with estrogen. These cancers are reduced about 60-fold for patients after bariatric surgery. And we go on and on and on. Almost every major medical issue that you have after bariatric surgery is either improved or in remission afterwards. So it's amazing. We think about bariatric surgery for weight loss, but I really want people to think about this health. Question I ask patients when they're not sure about surgery. I ask them one simple question. Where will you be in 10 years if you don't do something significant, right? I have patients come to me at 50 years old, I'm scared about for surgery. They weigh, let's say 300 pounds, their BMI is 47, they're diabetic. Well, where are you at 60 years old if we don't do anything significant? We've tried to do it the other way for the last 50 years, and then we're here today. So if you look at yourself in the mirror and realize, hey, this surgery can be outpatient, it's as safe as getting your gallbladder out, and it can give you the long-term weight loss and resolution of medical problems, it ends up being a no-brainer whether weight loss surgery is for you or not. But if you're a patient and you're thinking about weight loss surgery, or even thinking about medical weight loss, because we do that here too, give us a call. Here at Tampa Weight Loss Institute, we really are a program that invites you to our family for comprehensive weight loss. You can find us online at www.tampaweightlossinstitute.com or call us at 813-549-2392. Hope to see you soon.